Forward to this computer. Hi, this is Concierge Orthopedic Sales Call for June 12th. Today we're going to talk about packages that sell, selling packages, why packages, what the packages are, and how you actually sell them. So we'll have the whiteboard up here, and Shania and Kellen, y'all feel free to type in here. So like you can actually move your cursor around and you can see like when we come up to some of these and yes, you can type in little ideas. So first we're going to talk about why you would sell packages to start with. So of course, some of it's monetary, right? Like your normal rate, my normal rate for an eval is 175. Follow-ups are 150. And so what we do is reduce that by 9% for the packages. So for example, it's 894 for 6 visits, versus if you do the package, it would be 829. So they save $65, right? So you can look at that per visit and it's 149 a visit or 150 a visit versus 134. So they're saving what, $16 ish, is about what they're saving. And so, what I've been seeing is we kind of sell them. I'm jumping a little bit ahead about what packages, but we typically, like myself and Shania, have 4, 6, 8 plan of care packages we use. We have some other providers. I mean, Brandon's done 8, 10. He might have even done 12. Has he done some 12?
He's done some like 20s, but I feel
Oh, he
like
might.
sells the 10 the most. Yeah, I think he's
Yeah.
backed off from those, but the 10 is his most lucrative one for sure.
Yeah, yeah, absolutely. And you'll kind of find like what you feel like is best for your patients too, is what I'm seeing with this. So mine is typically that 829 package, which is going to be the 6 visit plan of care, which means my average patient revenue is going to be a little over $1,000. So everybody that walks in my door, if they're a qualified patient, like if they, are appropriate, I guess I should say is the right word for like a traditional like plan of care, they're going to be $1,000. So that's exciting to think about, right? Like every new patient I get, $1,000, $1,000, $1,000. That's not always the case. You'll have some one-offs. Like I treat a lot of volleyball players, and the big tournament is this weekend. So it's like I have seen some every single day this week because it's crunch time before the tournament, where I'm not going to sell them like a plan of care package and have the whole spiel of like, it's going to take this many visits to do this because their goal is to just get to the event, right? So you can absolutely shape this to what works best for you. But what I will say, the patients that I show these packages to, which we'll go into in a minute, the retention of these patients, I mean, I would say it's like 10 patients come in, I'm going to sell 8 to 9 packages. Another number I should have looked at. I looked at how many packages I sold this year, but I didn't look at how many new patients. That would be an interesting number to look at because that would kind of show my conversion rate for packages, right? I'll have to pull that number up later and text y'all. But the biggest thing I've seen is the patient retention. I've got several patients who, after one guy in particular, I'm thinking of, he had some shoulder impingement, came in specifically for dry needling, and I said, "Hey, um, I really think that you're going to need a full eval. Like, I really want to know why it's feeling like this, what's going on." So we did the eval, and I said, "You're going to need 4 visits." After 2 visits, he was like 75% better, which I would say most patients stop there, right? Because especially if they're paying cash, they're like, "I'm good. I'm going to he's active, he's knowledgeable. He would have been okay-ish. However, then he came in for the 3rd visit, still doing well. The 4th visit, some different things kind of popping up like, hey, I started to do more, and then this started happening. If he had not purchased a package, he would not continue to come in and us to be able to work through some of those issues. So a lot of times what I'm doing is kind of reserving that last visit. So they're feeling better. And then I'll say that's what I want. I want you independent. Let's take this last visit and do 2 weeks or 3 weeks out. And let's see, as you integrate into real world activities, what does that look like for you? What other issues are coming up? So that's one of the bigger things that I've seen is the patient retention. Have you seen that, Shania? You do packages.
100%. And I think the big thing is like you said, there's some patients who like it's going to be a walk in the park. They're going to be better after two, but like maybe they would be quote unquote done. But then it's like, oh, I got two more. Great. Because, I really wanted to work on XYZ, even though I'm feeling good. And I think that's
Right.
where a lot of patients fall off. They're like, I don't have pain. I'm good, but it's like they don't continue. So I think that's really been a solid point too. And for instance, I had a new eval individual who didn't want to do a package just due to finances and has canceled like twice. One
Mm.
of which was like cancel and one of which was just because of work. But I feel like you don't get that with packages. They always show up.
Right, exactly. I mean, they are invested. We've said before the nice thing about cash pay patients is that they are invested, literally, monetarily invested in their outcomes from therapy. And this just takes it to a whole next level because it's already prepaid. So, like, they already kind of know, not kind of, they clearly know that plan of care, that course that you're going to go on, and the goals that you have for them. You set those expectations up front. Um, and so it's really a win-win. And I was so hesitant to do packages. So this is funny that we're having this call 6 months later. So in these 6 months, really 5 months, I've sold 19 packages. And so I know, so exciting. like I said, I need to see what number of new patients I've had. I want to say I've probably had 25 new patients, 24. It's a different, because like some of them are athletes, like I said, so it's a little different. But so I would
Mhm.
say normally, this is where I'm getting these numbers right here. Normally, I would see a patient one time and have two follow-ups. That's kind of been the trend. I've done this for 9 years in cash pay. I kind of know. I'm going to see you once. I'll get you sold on two. You're probably not doing any more than that. So that means that that revenue for those 19 patients would be close to $9,000. Whereas now, since I'm doing these 19, now I've had a whole lot more patients and visits than this, but these are just the packages sold. So if I sell 19 of that middle of the road package plus the eval, because that's what you're doing, right? You look at this number, you're doing your eval, you're charging your eval, and then you're charging your package. So that, look at that number. That's a lot different. That's more than double.
Mhm.
So that speaks volumes to me, just as far as like I'm getting more people, even a higher level of function, plus I'm putting more money in my pocket. So it just kind of further reaffirms that this is a good model for our business. And the way that, just logistically, the way that that looks in Jane is that I would bill an eval, and then Shania and we've talked back and forth about, do you also bill the package before or after? I've had a couple of packages I think slip because I would say, but don't worry, we're going to build a package the next visit. Well, something might happen and they wanted it. They did want it. And then they don't make that next visit, or that next visit doesn't happen for another month. And then you just lose that momentum. So when you can close this at the eval, you get better outcomes. You just do because they're committed. Um, and so how are you handling that now, Shania? Are you doing it separately or
Yeah.
together?
It's kind of funny that you just said that. So I had a new eval post-op knee, went through her, 12 visits in rudimentary care. And this is a great example because I had her last week. Totally bought into a package, just didn't want to pull the trigger during the session. Usually they always do. They're like, yeah, 9%, good to go. But again, unique situation. She's already had 12 PT visits. She's coming to me just for more functional, recreational things, and she's not where she needs to be by any
Mhm.
means. I would not have discharged her in normal physical therapy services, but that's a conversation for another time. So I'm going to follow up with her actually today and just be like, hey, is it okay if I still bill you for that package? I know you wanted to look at the service menu one more time and kind of take a little time to think it through. Otherwise, when I see you next week, it'll just be that normal price. So I think for me, I'm always with the intent of selling it there because it's the easiest way and it's a less waste
Mhm.
of time for you having to do that second contact. But if
Yes.
they are hesitant and they are bought in, do a follow-up and be like, hey, just want to check, like, do you still want that 9% discount or are you okay with just paying per session? Because that is
Oh, write that in there. We need to write that one down. Yes. Yes.
okay.
Are you still okay with that 9% discount, or do you want to pay full price? Yes. That is,
I'm so not even uncomfortable with selling at all. Kelly knows this. So
I
I will ask them.
know. You're so good at it. It's so incredible.
It just takes
But
time. It's honestly, it's not that I'm always comfortable with it, but it's the wording that makes you comfortable. Like it shouldn't be pushy. It shouldn't be, unnatural, but just like we're giving them a discount on healthcare. Like, why wouldn't you want that, right?
yes, well, and it's also like your intent comes across because like I really want to make you better. Like I am your biggest fan. I that like when you personally, like Shania, not just you, general, plural, sell, when Shania sells, you know that she's actually like really like this is what I think is best for you, and that's why I'm presenting it to you because she is going to find a bargain. Let me tell you. Like she's not a big like she's not going to sell you something you don't need, you know? So I love this little quote. We're gonna have to highlight it. So right now, like I said, we have these different plan of cares. So we have the 559, 829, 1099. I have started doing, which I'll show you what those look like. I've started also doing a monthly membership. So here's like our plan of care packages right here. And we'll talk more about what to do with those in a little bit. But that's our model, and you can see like this is what the price would be if they paid full. And this is based off of the 174.99 and 149 rate. So obviously it'd be adjusted depending on the daily rate. And can you see maintenance membership? Is that showing?
No. So I scrolled up a little bit. Where your cursor is, there's nothing there. So I don't know if our little guy is covering it or what's happening.
Oh, do you have to scroll down on the whiteboard too?
I'll try. I scroll all the way down and it's yellow. Kellen, can you chime in? Can you see anything?
I can see it, the maintenance membership.
Yeah, you may have to roll down on yours, Shania. So just go to the bottom. You know what it is though, so it's okay. As long as
Yeah, yeah,
Kelly
yeah.
can see
Okay,
it.
sorry. Sorry. I was still on the whiteboard.
Gotcha. I think it's
Old dog,
because
new tricks here.
yeah, so we both because Kellen was scrolled down as well. Yeah, so there's Kellen's. So
I'm like, what is
it's
this?
membership. So I only offer this to people who have completed their plan of care. This is not just going to be anybody who walks through. And so I'm going to start offering these this month. I have several patients that I'm going to present it to. We'll talk about how I logistically present that to them. But what would be included in that is a recurring 149 fee, which you set up through our EMR through Jane, home exercise program, dry needling session, one dry needling, one cupping, or I would be fine if they did two dry needling, no cupping, two cupping, no dry needling. Because I have some patients who like only like cupping or only like dry needling. With the home exercise program, we of course have HEP to go that comes with our concierge ortho subscription. I am using PhysiTrack, which is integrated into our EMR, Jane, and you can get a discount through Jane for I think it makes it $16.99 a month. And what's nice about it is I can go in and I can change their home exercise program and I don't have to resend it. It automatically updates on their end. So they use an app. There's they set reminders, exercise reminders in there so they get a notification on their device, hey, it's time to do your program. And then they would pull that up and they would be able to see the new exercises. So I can extend their programs. Like if they're still a paying client, then I extend it. If I discharged them or they started not being compliant and their program expires, I let it expire. So that's a great little integration there. Okay, I'm scrolling up. Can y'all
I
see
have
back?
one question.
Yes.
Okay, so with this cupping and dry needling, because I'm like a numbers person, with the 20-minute for cupping or 30 for dry needling. So if I'm looking at this as the buyer, I'm
Mm-hmm.
like, okay, why wouldn't I just do two dry needling then? Like you said, because it's 30. Like, would you keep the time the same? Like you would do 130 dry needling, 120, or would you do 230 and you know what I'm saying? Because that's 50 minutes versus an
Oh,
hour. So
I
like,
mean, it takes about
is it
30 minutes.
similar?
I guess like if your goal is to have more time with me, then yeah, it would be dry needling. But for most of these people who know what works best for them, they would be picking it solely for the purpose of this is the best tool for me,
Okay,
the best
perfect.
treatment. But I see what you're saying, time wise, like why wouldn't you pick two dry needling because it's an extra 20 minutes with me?
Mhm.
However, not everybody wants dry needling. They would rather have
Right.
less time in cupping than more time in dry needling. Does that make sense?
Very true. Yeah, no, thank you.
Okay, I'm scrolling up, Shania, so make sure you can see the whiteboard again. Yeah, there you go. There you go. So can you see how to sell packages in the green?
Mhm.
Perfect. So the handouts, I showed you the picture. So literally when Shania was in town in January, we printed these out, I laminated them, and I have them in my bag wherever I'm treating. And I say, like this script right here, you can find a lot of scripts on selling packages and just selling cash pay in general. And so, I'll say, I've been doing this for 18, I think it's 19 years now. I've been doing this for almost 20 years. And what I can tell you that it's going to take 6 visits to reach whatever goal that is. This is specifically from Cash Pay PT. People in your situation do well with a 10 visit plan of care. Fortunately for you, this kind of goes back to what you just said, Shania. Fortunately for you, there's significant discount for payment in full, which brings the session cost from, in our case, 150 to 134. And so, yeah, so I think that's like how your little, so would you like to get the discount or do you want to pay in full price? Is a great way to say that. But so that's what I'll do is I'll actually show them this and I'll say, because it has 4, 6, 8, I'll say, this is the session. This is the plan of care I would recommend. I do not hem haul between. I pick the one that's best. Like, I'm like, this is what I recommend. I don't say this or this would work for you. I've done that before, and that just doesn't sound confident. It doesn't sound like your doctor is typically not going to, I mean, sometimes they will, but for the most part, they're not going to say, you either need this medication or this one. Which one do you want? It's like, I recommend this. And then if you had a question about the plan of care, oh, well, that's interesting. I really think that if the patient's saying, I really want to try the 4, then okay, like let's have that conversation. But I want you as the prescriber to be very confident in, hey, I am prescribing 6 visits. I am prescribing 10 visits. Because that's within our realm of responsibility to say, hey, this is how long that plan of care needs to be. And so I also liked this little at the bottom. The investment to get you back to whatever is $14.90. And I had a patient recently who she had to drop out of police academy because she was having so much pain in her calves with running, and it's very physically intense, that training. So she dropped out. She quit her job to do police academy, but since she dropped out, so now she's unemployed, she's uninsured, and she found me. And we spoke, and I said, in my experience, I really think that I can get your pain reduced in this first visit. This is the price. I have availability on Monday at 8 a.m. Yes. So she comes in, and she needed the 6 visits because we're going to work through the summer. She's working with a trainer. And so I set this up to say, like, she's not wealthy. In fact, she's hurting for funds, right? But she looks at it within that frame. We talk about framing our offer, right? Like, what is her house? Like, what is her goal? Her goal is to be a police officer forever. That's her, like, profession that she has chosen. So that is the framework I want to put all of these offers in for her. So the investment to get you back into police academy and complete that training is $829. And that's a different sentence than it's going to be $829 pay up. Like, that's just when you look at, like, when you present that value in context of their goal of that house that they want to build, it's very different. Which is why it's so important for us to listen to, like, their end goal, right? Even if we're just selling packages, like, we're not just selling packages, we're actually allowing them to invest in their goals. So you do a lot of the pre-booking, right?
Oh yeah. I book like
I don't
nonstop.
how do you handle that? Because I know, I realize and recognize that is a great way to just help with retention as well. But how do you have that conversation?
So with the pre-booking, I'm always like, my schedule's filling up in July. I just want to make sure we get something in the books so we're not, losing track. I think you're going to need to come in once a week or once every 2 weeks, pending. And then I always do what you do, usually towards the end, like, that's the beauty of when you sell a package or even just in cash pay in general, like, they may be solid at that last, like, maybe we'll discharge you today, but you're not quite there. Then I'm like, okay, let's wait a month, So for example, frozen shoulder patient, she's been on my calendar since, I don't even want to say, it's been a long road. It's been a rough road. But you know what? The last session, she's absolutely killing it. She texts me, she's doing great. So I'm like, let's push out a month. So we got that on the books. And it's just like you tell them, this is really going to allow you to ensure that you get in. So we're not, taking a step back, things like that. I think casting the vision of that versus like, oh, we'll just wait. I'll text you. That not only takes more time for you as the provider, but you're not sending 10 emails back and forth too. Like, oh, we'll talk, we'll get something on the books. No, every session I always book them out, at least 1 to 2. And then, if someone discharges from PT and they need training, I book them out like a month just because that tends to be something where they want a normal, like maintenance program cadence.
Okay. Yeah. And that's one thing I need to get better. I mean, mine are week to week. So I have like 20 visits on this week, but then I don't have anything next week or 2 weeks, So it's like
Yeah.
every Friday and even into Sunday night, I'm hustling to, oh, wait, they need to be here and they need to be there. So that's good. That's some good feedback for me to integrate, for sure. So let's take just the last like couple of minutes. And I wanted to maybe brainstorm if we have any, like packages, like ideas for new packages, I think could be cool. I know Riley spoke about maybe some personal training ones she wanted to add, and then even some handling some objections, or if there are any objections that y'all can think of or have heard, and maybe we could address some of those as well. So, do you have ideas for other packages, guys?
I think can I do one objection really quick? Because I thought of
Yeah.
this while you were talking. Okay, so your police officer patient was someone who doesn't have the option of insurance. So it's
Right.
like surefire sell. Like obviously there is no other option. Like it's cash pay or you're not getting better. But I
Right.
think if you someone who will say police officer who's in the network, right? They're in their training, they're still doing it, they're getting paid through their employer. And maybe you say, okay, 829, and they're like, well, I have a Naval scheduled next week with an in-network provider. I think I'm just gonna stick with that. Cause like I feel like I've had that a couple of times. Like obviously you knock it out of the park in the Naval and they don't even want to go to the next provider. But I'm just saying for a point of conversation, sometimes they'll want to do that. Like it's like us getting a second opinion on XYZ.
Right.
Um, so I think handling that objection, do you want to talk to her or you want me to?
Um, Yeah, I had this happen actually recently. And I said,
Okay.
"Oh,
Good.
next week." And I would just say, "Tell me more about your pain. Tell me what's going on." And like I want to know the urgency because there might be something that's totally appropriate next week, and that's fine. But a lot of times when people are reaching out, they've waited too long, they're already in pain and they're missing out on something. So that's where I want to dig into is I want to say, "Well, tell me about your pain. What kind of things is it keeping you from? What are your goals with physical therapy? What's your week like?" Eventually, my ultimate goal is to get them to, I can get you in faster and get your symptoms reduced or at least altered during the first visit. That's where I want to get them. And then they say, oh, okay. And then I'll say, hey, if you want to continue with that in network, when you can still have that on the books next week. But let's go ahead and get you in now so you can get relief now.
I
Is
love that.
what would you do?
Yeah, I would do that. And then I think like if you can get them for the eval, they're sold
Yeah.
99% because I had someone too who had thoracic outlet syndrome, was misdiagnosed and like got missed. And she's like, I didn't even know I had nerve issues. Like, ow, like you're testing these. I didn't even have a clue. They didn't look at that. And like they're just like, yes, keep telling me more. So I think like if you can get them in for the eval and use what Kelly said, get to the bottom of their pain, use that sense of urgency if your schedule allows, and then sell them in the eval based on your, in-depth 1 hour with them, like golden.
Yeah.
Because then they're going to be like, oh, this is amazing. I learned so much. Like, and they can still keep that in network. So I had someone who's on my caseload now who still goes, but maybe
Yeah.
they'll cancel or it's not consistent or, because like they're paying insurance. So maybe they still want to. And that's not stepping on our toes, nor should we be offended. I think the natural tendency is for us to be like, well, I'm a better PT. Like, why are you going to that? No, like
Right.
we're all in this work together. Like maybe they'll learn some clinical pearls that we don't go over. But at the end of the day, like sell them on the value and they'll keep coming back, no matter if they want to do that in network in tandem or if they want to solely switch to you.
Yeah. I like that. What other packages have you played around with selling?
Talking to me.
Mm-hmm. Or
I
Kelly.
think
Awesome.
Yeah, I think the personal training has been great. I mean, I think we get to a point in PT where it's like they need more, or even like we've talked about the wellness. That's always like, and that's what Riley had brought up too. And I think it's just a great adjunct because people want our expertise, but maybe they're, not in pain. It's more the preventative medicine. So I think that's kind of where the profession is going as a whole too. So, maybe it's back to your old point, Kelly, and this is appropriate for some prehab individuals. Like you see them, then you're
Mhm.
like, maybe they're not appropriate for a package because they aren't like, maybe they have a little bit of like pickleball or tennis elbow. You see them, you do some dry nailing. I'm just using this as an example because I just thought of it. But after like one visit, like they're pretty good because they weren't like in a ton of pain. They just want to be able to play pickleball with the grandkids all summer. So I think that's where like that maintenance program is going to be great, but also maybe offering like a preventative medicine, like home exercise program. And we have something in our survey too that it's like, are you interested in a maintenance plan? So I think talking more to that of like, can we construct something that's more of a maintenance HEP? And kind of see what that looks like from a package perspective, not just I know you got the little HEP in your 149 option, but maybe it's just solely an exercise one that we do,
Mhm.
It's like every
Yeah.
month we look at your program and see how we can tweak it, or every 2 weeks.
Yeah. Yeah. I think those are great. I put nutrition on there because Kellen is a nutritionist. So
Love
that
that.
would be, yeah. Or even like a package that's monthly maintenance and add on a nutrition consult or check in once a week or once a month or whatever that needs to look like. 'Cause
Kellen, what does that look like for you? Like, can we refer people? Is it a Texas base? Is it national? Like, what are the logistics on that? Because I would be interested in sending some clients your way.
Yeah, absolutely. No, they don't have to be just in Texas. And I definitely do. I have kind of a low patient volume at the moment, but I definitely see more patients for PT than nutrition. But on the nutrition side of things, then I offer that available as an in-person consultation or as like an add-on to a PT session, which is
Okay.
usually how most people prefer it because most people reach out for PT in the first place. And then if there's during my eval, I always ask questions about if there's relevant things related to nutrition. And I have one patient right now that I'm seeing who she just had surgery and has had kind of a decline since and lost about 20 pounds related to decreased function and changes in medication and decreased appetite. And so definitely some strong nutrition implications there. So that's something that we have done as like a incorporation or add-on to PT in a small capacity. But yeah, I do. I also have it technically as an option for virtual patients who just want to do that only. So that would apply to folks that are out of state or wherever, if they wanted to do a virtual nutrition consultation too. So yeah, thanks for asking. And if you have anybody that applies to, please send them away. So
I love that. So, like, let's talk about that from a package perspective. So, we offer the consult. What would that look like for like a maintenance? So, like, say I have someone who's elderly, who's horrible with nutrition, which I do have someone who might be a good candidate. Um, who I send to you, you do the consult and then the package. What would that look like from a package perspective? And you don't have to have all the answers today, but like in terms of like longevity of seeing clients, what do you feel like is the trajectory? Is it like you talk with them for 3 months, then they're good to go? Is it something they need to continue with you monthly? How could we construct a package that would be, not only lucrative but beneficial for consistency?
I think like PT, it kind of depends on what the goals are there. So for somebody who maybe is like an elderly person who has, it's not necessarily that they're like trying to get ready or recover from something or train for an athletic event or something along those lines, then maybe it is a little bit more of a longer term maintenance checking in. So I would say in terms of frequency, and this is the tough part where it's usually a good complement to PT, is that the follow-ups are usually more spaced out. So yeah, more along that like monthly, maybe from the initial evaluation, maybe like about a week later or 2 weeks, checking in, seeing if we need to do an early like pivot in some of the goals or the plans that we're working on, and then that kind of monthly follow up. But yeah, usually maybe only like two or three if it's a person who is really just trying to like establish something in their life, either preventative or getting to some sort of athletic event that or getting to or through a season, a sports season or something like that. But if they're if they're somebody who is like you're saying an aging population, or if they have like a health condition that they're wanting consultation to manage that has nutrition implications, then that could be longer out. So maybe a package would be better for that. I definitely think that the things that you're talking about with PT apply here too, though. If folks, may have that hesitation for like a month out follow up, being able to say, hey, well, let's go ahead and do a package of 2 or 3 follow ups like down the road. And that may have better outcomes for the patient as well as better retention. So I like that idea there too.
No, that's really good. And I think the nutrition piece is a whole untapped market. So many people need it, and we don't always, know where to go directly, right? Like we could refer them to an in-network dietitian, nutritionist, but that's not always the best. Very cookie cutter. So having someone in-house, Kellen, that's great. Just for the team. I mean, blurt that on Slack, and I'm sure there's other providers too that could benefit. So appreciate that. I think one more thing to talk to the 2 to 3. Kelly, what are your thoughts on you get someone through that 4 or 6? Let's do the 6 because that's the one you sell the most. You get them to the 6 and they're needing more, but you're like, ooh, you don't need 4. You maybe need like 2. So what if we created like
Yeah.
a baby package? I don't know.
That's a good question. At that point, they understand. They've had the education and seen the benefit. So I have someone, I had 2 people this week who ran out of packages and came in. And so I just say, hey, I noticed that your packages ran out, so I'll go ahead and just charge you for the visit unless you want to buy another package. And I can show it to them. But typically, I just will charge the regular price because they're tapering down at that point, right?
Mhm. Yeah. Do you think it'd be good to do like a mini package like Kelly talked about, like a 2?
I mean, no, ours are so small. Like, I wouldn't do less than 4.
Okay. Okay.
Yeah, because then it's like, I mean, you know,
Yeah.
yeah, that's just personal though.
No, it's good. I think yeah, it's a little much then too. And like
Yeah.
they already know the value. They're gonna be fine with
Mhm.
paying $16 more. You're so right.
Yeah, absolutely. Well, thank you all so much. I hope this was helpful in just learning how to sell the packages, why you sell them, just starting some creativity around even developing new packages. Because the nice thing about owning your own business is you get to create what you sell as you see the need for it. So that's exciting. So we hope this is beneficial for all the people watching it. And thanks so much for your impact and your input, guys.